During this webinar, you will be hearing from Dr. Kimberly Volk, an SCNM alumna and Chief Medical Officer of the SCNM Clinic. Dr. Volk is a graduate of Southwest College of Naturopathic Medicine. She graduated in 2006. Her focus is as a general family practitioner. Aside from practicing medicine since graduation, Dr. Volk has been working at the SCNM Medical Center in many different capacities, which most recently in February 2012 was promoted to Chief Medical Officer. She previously served the last 4 years as Director of Clinical Operations. Dr. Volk has over 20 years experience in intensive care nursing. Along with her doctoral degree in naturopathic medicine, she holds a Bachelor of Arts in Psychology from the University at Buffalo and received her Associates of Applied Science in Nursing from Alfred State College. Her current certifications include ACLS and BCLS. Thank you, and at this time I'll turn the presentation over to Dr. Volk to begin her presentation.
Welcome, everybody. As she said, I was a graduate from SCNM in 2006, so I have a unique perspective. I've been a student, faculty, and administration. The SCNM Medical Center, we've been located on campus for over 2 years. We actually obtained the building and gutted the first floor and built brand new. We were able to design it specifically for naturopathic medicine and with a thought of our philosophy put in place. Therefore, there is an expansion that we made sure that Nature Cures was a part of the expansion with the Hydrotherapy suite. Arizona has a very broad practice. We have an intravenous therapy suite. We also thought about what the educational portion that was important for our students and our patients, so that we have the classrooms, the electronic medical records, and actually cameras from the exam rooms to the classrooms to provide a learning tool for the students. When we put this in place, this is the new medical center. When a patient comes in and they sign in and they're exposed to either private rotations or student rotations. With the students, most patients are seen on the student rotations where they're in their 3rd and 4th year and they're overseen by the provider. The patient will come in, the student clinicians will see the patients, develop the treatment plan with the guidance of a naturopathic physician. We've been in here, like I said, over 2 years. We have 27 exam rooms, 6 classrooms. We not only have a hydrotherapy suite and the IV suite, but we also developed the minor surgery area to expand that, as Arizona has a very broad practice that includes minor surgery. First, I'm going to talk about the hydrotherapy suite. It's important with naturopathic philosophy that is optimal, that is about the optimal wellness of a person, that we're not just treating the disease, that we're actually looking how can we get to the root cause of the patient, that Nature Cures a part of that. That means that we use water, heat, in the steam room, in the sauna, in the hydrotherapy area, where we do have a hydrotherapy care coordinator who is an MD, who is an expert in hydrotherapy. This is the steam room that was built specifically to the request of the hydrotherapy care coordinator, that not only has the hot steam to be able to provide that therapy, but it also has a shower that's specific to a cold temperature, so you can have the alternating hot and cold and actually be able to do the therapies you need to do. They also not only use it for the hot and cold therapy, but we do wraps, clays, and if a patient can't sit on the tile, we actually can bring in a portable exam table so that that a patient who needs to lay down can lay in comfort on an exam table if need be. In this hydrotherapy area suite, we have locker rooms where we provide slippers and robes for the patients for their comfort level to be in this area and not be exposed, to be covered up, but have the flexibility to be in a robe and feel secure. We also, in this area, as I had said, we talk about water. We also talk about heat. It's important that we have the sauna available because it's important in detoxification, when we talk about nature cures, how to use the difference between hot and cold and help stimulate the immune system. This area, we actually have a single sauna and a group sauna. The importance of the single sauna is that we have a lot of environmental medicine patients. Those are people who consider themselves toxic. They either can be toxic to us or we can be toxic to them because of all the exposures that they've had in their lifetime. Therefore, with the single sauna, it gives them the ability to be able to come in and be treated, but yet be able to get the treatment, but yet have the privacy and the least exposure that they need be. In these saunas, we also have color therapy. Color therapy can be used for the frequencies can be used for different diagnosis, such as there are certain ones that are used for detoxification, certain ones that are used to help decrease anxiety. If a doctor has the expertise and can prescribe it, they actually can prescribe the sauna with the color therapy and send the patient to make an appointment, and that they can go through the treatment plan. If they would like or think that color therapy is something that would be good for the patient, but they don't have the experience, they actually can refer to the hydrotherapy care coordinator, and that MD, which is Dr. Sarah Hazel, she will prescribe the color therapy that would be appropriate for the patient and the diagnosis. This is also a part of the hydrotherapy suite. When we talk about hydrotherapy, we talked about the steam room, we talked about the sauna, but then we also have an area where we do constitutional hydrotherapy. What that means is in this room, the patient has an alternating hot and cold towels that also with electric stimulation to help support and stimulate the immune system. There is, all of the exam rooms in this area are set up to handle this with a big prep area outside, so it gives the ability to give the patient privacy, but that multiple patients can be treated for this therapy. This is also another therapy that gets prescribed. The patient comes in with a prescription from their physician, and the treatment can either be defined by their physician or it can be defined by the hydrotherapy care coordinator if indicated that the physician wants that referral. The IV area, one of the benefits to get a degree in Arizona is that Arizona has a very broad practice for naturopathic medicine. They essentially can run as a family practitioner without feeling a lot of where they can't treat the patient how they want to. The IV therapy is one area that we have very expanded laws and experience. We can infuse anything that's IV-wise that is considered a nutrient. That can be very broad. Also, we need to consider that our doctors actually go through advanced cardiac life support, because if something should happen, nothing has ever happened, but they need to be prepared that if something should happen, because IV therapy is invasive, they need to know what to do in case of an emergency. This area, we actually staff with an RN most of the time. One of the reasons we staff with an RN is because we accept referrals, and a lot of our patients that come in for referrals are cancer patients, patients with central lines, including PICC lines and portacasts, and we would like to make sure that the process and the procedure is done correctly and safely. Therefore, specifically, we have an RN with that expertise, and that we expose our students to that kind of exposure so that they understand the safety measures that need to be included when they're going to do IV therapy in their own practice. It's not only would we staff with the RN so that a patient can be referred and just see the nurse, but also the student rotations that the students sit on, that they have patients that will do IV therapy. The students will see the patient, but yet they have the RN there if they have any questions and for them for immediate response if the physician is in with another patient. The students, and like I said, where they have the referral for the RN, where the RN will place for the portacast and the PICC line, but the students will also, they'll place the IV with the RN supervising or an ND supervising, so that they get the exposure and the experience, not only with making up the treatment, so to figure out what we can put in or what is needed for the IV, such as we treat the cancer patients. We also treat people who are malnourished. One of the things that naturopathic doctors do is we treat the gut, because often the gut has absorption issues that have been ignored or not necessarily addressed, and we know that that's a basis. So sometimes our patients need to help repair their gut, and we need to be able to give them IV nutrients to make sure that they get the nutrients versus that they can't absorb it through the gut. So it's important that we utilize IV therapy sometimes. Also, it's not unusual that we'll give it for immune support. If somebody has mono, or if actually they have the flu, or they just are starting to feel under the weather, that immune support IV is ordered to help support the patient. The clinical education, we recently revised our curriculum 2 years ago, and now the revised curriculum has entered the clinic. What I discovered is actually with the revised curriculum, the students enter the clinic much earlier. And I don't mean as if you look at the program, it actually says that they still enter it after the 7th quarter. What I mean by that is within the first year, a student actually gets to be able to be in the clinic by doing a medicinary post. That means that they get exposed to the natural medicinary where we have our supplements. They get to make up botanical tinctures. They get to be exposed to the dry herbs. But they also take phone calls from doctors and from patients, and they be able to learn how to start interacting with the customer. They not only do the medicinary post in the first year. If you start in the fall, they do it in the summer, and then they do it, if they start in the winter, you would do it the following year. But they also do the lab post, where you do a 12-hour post in the laboratory. You learn about, you not only draw blood from the patient, but you also learn what you can do in your own practice without a certification, or what we can do in our lab, because we are COLA accredited for moderate complexity. That means that we can do microscope work. We can do, such as we need to do a wet mouth to look at somebody's secretions, or if we need to do a urinalysis, that we actually can do that in-house, so we are able to treat the patient for what they need. That, like I said, is a 12-hour post, just like the medicinary. And it gives that exposure very early in the curriculum. Also, with the post, they also do, within the first 2 years, field observations. Now, most of those field observations actually don't happen at SCNM Medical Center, but some do still happen at SCNM Medical Center, to be able to give people exposures not only to the student rotations, but we have some private rotations where approximately 30% of the patients are seen on the private rotations, which consist of most of our clinical faculty have a private practice, but also other modalities that you might think we would want as naturopathics to be here so we can refer our patients, such as colon therapy, neurofeedback, biofeedback, the counseling, acupuncture, to make sure that our patients can get the treatment. Also massage therapy. With the clinical training, we have set up with the revised curriculum to make sure that the clinical training is exceptional. That means that to make sure that it's clear and concise, that even though we want to make sure that we're clear and concise, we don't want to restrain the naturopathic physicians on their shifts. That means I've been in administration for 4 years, and often when you get 30 naturopaths in a room, you'll have 30 different opinions on how you'll treat a patient. That actually is an important drive for me to want to be a naturopath, because it's important that we individualize all treatments for patients. But it also is important for a student as they learn that they have some consistencies, such as you'll find that a lot of physicians will treat differently, but what the expectations for the student is clear, such as how they do a physical exam, what the expectation for what their learning curve is actually outlined very definitive for the faculty, so that the communication between the student and the faculty member can be clear. That helps make sure that the patient experience can also be clear and concise. When we talk about creating the curriculum, we want to make sure that when we revised the curriculum, that philosophy of naturopathic medicine was a drive that was started from day one. One of the issues that people will complain about, because we want the philosophy, is that they are inundated the first 2 years on basic science, because we need to know that basic science foundation to become a good naturopath. But we get a little lost where we really want to make sure that we still want that embedded within that system. The revised curriculum makes sure that we incorporate both of them so that we come out ahead, that when you come into the clinic, you've actually already had exposure to patients. You've already worked on standardized patients besides on working on each other. After each year, when you come into the program, we have milestone exams after each year to make sure you have progressed to the point that you need to. And even after the first year, even you've had basic sciences, how they develop the curriculum, you actually are able to do a working diagnosis. So then when you actually get in the clinic, you're ready to go to start developing treatment plans, and you feel more comfortable. We also feel that it's important to make sure that you get exposed to clinical faculty that have a lot of experience. So we are required to make sure that all of our physicians, at least 90% of our physicians, and actually currently probably 95% of our physicians, have been naturopaths for at least 5 years or more. We have at least 50% of our clinicians actually have been naturopaths for over 10 years. That's important because we want to make sure that you get the experience of somebody who's had experience, not only as an academic exposure, such as faculty members who graduate and stay, but that they've also had a private practice, that they've had experience out in what people would say the real world, so that they can bring that business aspect into the rotation. We recently also implemented electronic health records when we moved to this SCNM Medical Center. One of the advantages is that we created a system, and we're still creating the system, that it is built specifically for naturopathic medicine. That means that when I took over as Director of Clinical Operations, what I learned very quickly in the practice management world was that all the systems were made for allopaths, and that we have to fit our medicine within that system. With Helios ND, we actually were able to create our own system and have it fit, which can be very unique, such as having the student being able to complete a note and have the physician oversee, and then all the different modalities to be accounted for. It's unusual to be in an allopath practice and you have so many different possibilities. Where in a naturopathic, we have 30 to 40, more towards 40 practitioners who all of them do very different things. And it's important to be able to get that detail in the electronic health records. Not only do we have it implemented into the clinic, but we now, with the revised curriculum, expose our students to the electronic medical records in their second year so that when they enter the clinic, they actually have already used the system, they've practiced on the demo system so that they're more prepared, that when the student clinician becomes into the clinic, they actually already have had that experience. So that's one step of a learning curve that it doesn't all occur in quarter 8. That's very important because it's already going to be nerve-wracking enough when you actually make that jump from where you really know I'm in clinic, I'm taking clinic rotations, because you're already trying to establish what I'm going to do when I'm finished. The typical patient visit with the student clinicians, when a patient calls in, our patient services have been trained to ask them, first of all, if they already have a physician that they want to see specifically or what they're looking for. Like I said, all of our physicians are very different, and sometimes you just got to make sure that you fit with the right person and the right modality. We have a lot of, most of our physicians are general medicine, but we have a lot of modalities such as homeopathy, physical medicine, acupuncture, and there's some that just as you graduate, you can't be an expert in all of the modalities. You choose and favor towards some other ones. So you want to make sure that when you fit somebody in with what they feel that they want to see, that they actually connect. Now the advantage is, being in such a big practice, we have the ability to refer and collaborate with each of the providers. So not only will that happen where somebody's seen, but it's not unusual for them, oh, wait a minute, maybe I need to refer them to Dr. Axelrod, who's an expert in rheumatology. Or I need to consult so I can have that person also give me advice to also participate in the patient's care. When the patient calls in, we'll set up an appointment and we'll talk to them about what that visit would be like. On a new visit, a patient will come in and they'll either send in their paperwork early, which is nice because if they can send their paperwork early, then that means it gives the student time to review and go over it, and that's time where the patient doesn't have to sit in the lobby and wait. So it's important for us as we go forward that we're looking at that efficiency stuff. Also, so then after they get to review the intake form, they'll come and they'll meet the patient. The physician will come out and they'll explain that the students are in their 3rd and 4th year. They'll have a primary student who's in their 4th year, and then a secondary student who's in their 3rd year, who's there to help the primary as needed. Then the patient will be taken back and they'll discuss, how can we help you today? It's important to know that you can't necessarily do everything in one day. So you want to make sure that you get to what is the #1 drive that is there so that you can make sure that you address that, and that when they need to come back next time, that you can address their less important stuff as far as they're concerned. Now, it's often because when a patient comes in, I recently had a patient come in and they were sure that it was their thyroid, but as I took their intake, I quickly realized that actually their stress probably stemmed from their gut, that their diet was related, and that I actually had to shift their appointment, not just to address their thyroid, because they still needed to address their thyroid so that they knew that they were being taken care of, but I actually needed to also address the underlying cause, what I felt was the underlying cause. So it's important to be able to relate that so that the student clinician knows that role and they can build up with that patient. When we talk about earlier, like really early in this conversation, I talked about that we had cameras. We actually have cameras in the exam room that is a closed-circuit TV to where that goes to the classroom. It's important to have these cameras not only for a learning tool. And how I mean a learning tool is that actually then whoever's not in the exam room, they actually can watch the appointment so that the patient can, so that the student can learn, even if they're not in that appointment. It's important to learn and have that exposure. But it's also important for the practitioner, the provider, that's evaluating the student and the patient, that they can actually observe the appointment but not disrupt the relationship that the student clinician is building with that patient. Because once the provider walks in the room, no matter what kind of relationship the student has built with the patient will address the physician, not the student. So it's important that the student is able to maintain that and that they are seen as part of that provider relationship. Also, the closed-circuit TV can be used the other way, where it's important that the students get exposures to that when the provider will go in and see a patient, and they can get the experience where they can view the clinician taking the case, treating the patient, and actually get that experience, vice versa. The patient's experience can be altered depending on what their student clinician does and what the provider does. So it's important for us to provide consistency and build that into the experience. We have a lot of things going on as we grow. It's important that we grow and be able to give all of our students and our patients the exposures that they need. Like I said, we currently have 30 to 40 practitioners, more towards the 40, because we're expanding. We have grown in this last year. We have increased our patient visits for approximately by 1,000 visits, and they're all attributed to the student rotations. We also, as indicated before in my bio, I was the Director of Clinical Operations, and now I'm the Chief Medical Officer. We've recently hired Dr. Owens, who is the new Director of Clinical Operations. It's important to have the two leadership roles in the clinic because we're going to expand. Not only is it important to be able to provide the education portion, but part of the education portion is to provide the business, to make sure that you understand, that the students understand the efficiency, that to be able to provide so that when they graduate, they're able to do, if they want to open a private practice or go and practice with somebody, that the business portion is outlined. Also, when we're looking at efficiency, it's important for us not to have a 3-hour new patient visit, so that we can have the teaching tool to be able to teach the student what they need to be taught, but yet not have a new patient visit to be 3 hours, because that can be exhausting. Even though it's a learning tool for our students, we want to make sure that the patient gets provided the care they need. One of the biggest difference between a private rotation and student rotation that I emphasize when I encourage somebody to be on a student rotation is not only, of course, the price is different, but actually one of the biggest things is the student rotations have a collaboration where you have students, you have a resident, and you have a physician that are all collaborating on the care, versus when you see on a private rotation, you just have the one physician. So the availability and what the collaboration brings is actually vital for the patient. So I believe that there's advantages to both. Also, when I talk about efficiency, we're looking at different aspects of business and how to make sure that we relate it to the clinic rotations and the experience for the student clinician. We have recently been working with Intel on a grant that specifically is to outline the efficiency at the medical center, to make sure that we have everything in place to make sure that we're providing the care that we need, not only for the patient, but the student. It's very exciting as we expand what other things that we might offer. Thank you very much. Do you have any questions?
Thank you, Dr. Volk. This was very informative. We will now open the floor for any questions that you may have, as well as address those questions that were submitted beforehand via our website. You can always request information from me at j.durham, and that's D-U-R-H-A-M, at scnm.edu. So I do have a couple questions here, Dr. Volk. My first one is, what are the average fees for a first-time visit?
On a student rotation with a student clinician, the fees for first visit, it can range for a public patient anywhere from $76 to $120. It depends on what the patient is coming for and what is established. We do have discount rates for people who are economy challenged, also students, also SCNM students, immediate family, and of course seniors. The follow-up appointments range anywhere from $40 to $70, but also for acupuncture, that is different. So when I quoted the prices that actually were specifically more towards a naturopathic visit, if it's for acupuncture, the first visit for student visit is $55, and then follow-ups are $45.
Very good. Thank you very much. My next one is, how many patients does a student typically see per shift?
It depends on the modality and the rotation. I actually have a student rotation, and my students usually see 2 to 3 patients a shift. You might be on a rotation where the patient's visit might be initially a little longer than on my shift, so sometimes it's 1 or 2. It depends on the modality. There are shifts where they see 3 or 4.
Very good. Next question, how many patients go through the medical center per day?
Oddly enough, it depends on the day of the week, and it depends on the doctors that I have there. Approximately, depending on the day, it's 60 to 115. So it can really vary. One of the variances is on Fridays, I only have rotations from 8 to 6. So I have less availability for appointments. But on my Monday, Tuesday, and Thursday, it usually runs 90 to 120 patients are seen through the clinic a day. We are looking at, like I said, with the 2 positions, with the Chief Medical Officer and the new Director of Clinical Operations, we're looking at our efficiency and how we can increase that each day. So if it's the modality that we offer, if it's to make the shifts more efficient where they can see more patients, we actually are consistently evaluating there. And then I can say in August, we actually had our highest month ever for visits on a student for student rotations, and that I checked October's numbers. They actually will, the end of this month, we actually probably will have our highest month ever for student or patient visits.
Wow, great information. Next one, you had mentioned different sites that the students do their shifts at. What percentage of student shifts are done strictly at the medical center?
65%.
Wow,
and then
great.
our other, we have extended sites and that's probably another 30%, and then we have elective off-sites that are available for people.
My next question is, as a student, can I get IV therapy at a discount?
Actually, you can get everything at a discount. So when we look at the IV therapy specifically, you won't necessarily get the solutions at a discount, but the procedure itself is discounted that you only pay 25% that the public patient would pay.
Okay. My next question is, do you find anything challenging with electronic health records?
Building a system from scratch is challenging. The transition was a challenge. One of the things that's very difficult when you change over to electronic health records is that when I talked about our experienced clinicians, most of our experienced clinicians, therefore, are a little older and not necessarily, they're a little electronically challenged. So the transition can be difficult and fearful for the practitioners. One of the things that we did that really helped the challenge and that we continue to do is that we actually have electronic medical records tutors that the students will do federal work study. They actually sit on the rotation and they're there to help the students and the providers so that they can continue to help with the transition. We have to have the practice management portion is implemented and also the health record is implemented, but we still have the medicinary portion and the lab portion that is not completed yet that we're working on. So it's important to us to make sure that we provide continued support and more consistent support. We also recently, the IT department will help support us where they are involved. And like I said, it's important that we continue to keep that open. So the challenge is that we build it, we're still building it from our perspective, then also making sure that everybody can get trained.
Great. My next question is, are patient visits covered by insurance?
We are currently Cigna providers. That means people with Cigna, that a certain amount of them have naturopathic coverage. But it's important to know that a lot of insurances actually have an alternative clause. So such as, I always use Banner for an example because they're the second largest employer in Arizona, where they employ 28,000 people. It's important for us to know that even though we're not one of their providers, they actually have a specific clause in there that they do provide insurance for naturopathic medicine. Therefore, patients come here, they pay cash, and then they submit it to get reimbursed a certain amount. So it's important for us that we keep abreast of that we can educate our patients. We actually have a committee that works on finance and insurance so that we get more informed, that we can become providers for more insurances, but also that if a patient has that clause in their insurance, that we encourage that they submit and get the coverage. In general, the public is more demanding of naturopathic medicine as we're more preventative and we look to make somebody have optimal health. So if you look at insurances, more and more they're providing that care. We're just making that connection now.
Great. Next question. Do you feel it's helpful for students to learn a larger breadth of medical information if they are intending to practice in a state with more restrictive NDs laws such as California?
Yeah, I think it's important to actually get your medical degree in a state that has a broad practice. Not only because even if you're going to a state that has a restrictive practice, but the importance is, and we've heard this when I was going through school, where you have a lot of students who will complain, I don't want to learn pharmacology, I'm not going to do it, but actually you're going to do it. Not because you're going to prescribe it, but your patients are actually going to come to you on that medication. So it's important to have that as much learning as you can do, because the patients you're going to deal with are from the allopath world, and you're actually going to have to be able to be comparable and competent in all of that. Whether you can tweak it and actually have the prescription orders, because it's also important to be able to, when you're in a restrictive state, because you actually have to build that relationship and have that consistent relationship with the MD so that you can communicate with them and that they respect you on the same level that they are.
Great. Next question. Are the electronic records available to the patient to log in and view their medical history, their prescriptions, their treatments, etc.?
The patient portal is not available at this time. It will be available. That is another thing that we're looking to be able to implement. What's important about that, we are in the, hopefully in the next 6 months, going to implement that portion where I see the patient portal is important, not only that the patient can see, but also it's where you can actually assign that they can do their patient intake form, their questionnaires that we have, their diet diary. So they actually can do it before they even come into the clinic. So it drops into that encounter note, and it can be evaluated by the student and the clinician before the patient shows up. Once we get the patient portal up and running, that actually, I think, will dramatically reduce the time efficiency in a patient's visit. To be able to view a diet diary before a patient comes in versus that when they come in, they hand you a diet diary and then you have to go talk to the clinician for 10-15 minutes. That's 10-15 minutes to tack on their appointment. That will be very vital.
Great. Does the medical center have a long waiting list?
It depends on the doctor. So there are certain doctors who we are booked out that we are looking to book in January at this time. But most of the time we can get, especially for general medicine, we can get a patient in fairly quickly. Where as we expand, we do book 50 to 75 new patients a week. Pretty consistent. So we are getting an exposure, and we will start running into that more consistently. But we are looking to evaluate as we increase our efficiency. We actually can increase our appointments available and make sure that patients aren't waiting. We also have, for certain doctors who have that wait out, we have a waiting list to make sure that when there's any cancellations, we can call people and ask them if they'd like to get in sooner.
Great. Do you provide antibiotics and other formulary drugs when necessary, or do you refer them?
In Arizona, we have prescriptive rights. So personally, with my experience and my background as allopathic medicine, I feel very comfortable that if I need to provide it, I need to provide it. So I don't hesitate that I'll provide antibiotics if need be, and also other medications if we need to support the patient in that way. It's important to be able to provide that because sometimes you're going to have patients who are going to need the medication until you're able to make lifestyle changes that will make a difference, that you can maybe get them off the prescription. The difference is, I prescribe an antibiotic when you need be because I understand what the reason is behind that. We'll do other things to help support their immune system. But also, if they have other reasons that they need to have a medication, such as for hypertension and so forth, we work through that. And I never looked at a medication is for indefinite. That means that my objectivity is always to be able to get somebody off medication versus if they stay on it. But I will use it when needed.
Great. All right, Dr. Volk, I think I have 2 more questions here for you. How often are the students in the clinic versus the classroom? So, and when you say classroom, that's tricky because in the first 2 years, you're mostly in the classroom, but you're not always in the classroom. We have a revised curriculum because I see it also as lab. You have significant lab time in your first 2 years where not only you're in the classroom, but you actually, you're going to participate in dissecting a cadaver, but also we implement this where you start learning your clinical skills after the first week. You actually learn how to do vital signs, and that's an expectation. So you actually have lab significantly. If the question is about what's your exposure to patients, we ease you into that. So the first year, you'll have that exposure with the clinical practice in the lab. You'll have your field observations, but then you'll also have standardized patients, where after the first year, when you do your exam, where they test out to see where you're at, you actually don't do it on a fellow student. You actually do it on a standardized patient. So it's not a patient visit that is actually seen at the clinic, but it's a standardized patient, so it will feel like that to you for the exposure. When you get into your 3rd year, before your 3rd year, you have your field observations where you do 40 hours. You do 12 hours in the medicinary, you do 12 hours in the lab, and then you have all your clinical practice time in the lab with your diagnostic practice. When you get in the clinic, it phases in, where your quarter 8, you'll have 2 clinic rotations, and as you get further into your clinical practice, you have more and more clinic exposure.
So with the revised curriculum, that's a tricky question. I hope I've answered it as complete as I possibly can.
Great. And my last question to Dr. Volk is SCNM and other naturopathic schools pushing for more insurance companies to cover their treatment?
Well, I would have to say that Oregon and Washington are already covered. So I would say that those schools, it's not necessarily you push for it, and I don't necessarily push for it because it's that whole difference between cash and insurance that that actually the allopath world is struggling with. We're looking to be more informed and make sure that our patients are more informed. I don't find at this time, being a Cigna provider, that it has financially compromised me. But I understand where in the allopath world they do feel compromised with all the insurances. What we need to do is make sure that we're well informed and that the public is well informed on what the advantages are, and it's not our necessary drive, but that we want to make sure that the public is aware. As I always get asked these questions from an administration, such as, what about healthcare reform? That's where this kind of question can come into play. What's important to know is that with healthcare reform and in general how insurance is going to start looking to pay for performance, obviously naturopathic medicine, with our idea that we get to the root cause and that we want to do preventative medicine, we obviously are the best medicine for pay for performance, because my whole drive is to make my patient well. So we don't necessarily have a drive to become more providers for insurance, but we become more informed, such as if it's covered in their insurance, we want to make sure that they get reimbursed and they utilize that aspect versus that they just pay the cash and don't get that. If somebody has insurance that provides it, we want to make sure that they can get that care.
Great. Thank you, Dr. Volk. And I appreciate everybody's questions. Those were great. As you can see, I brought up the admissions requirements to apply to SCNM. They're on your screen. And the only thing that I really want to go over that is going to change is the completion of prerequisite coursework. This is as of, all of this will still be the same, but as of fall 2013 and beyond, the prerequisites are going to change a little bit. They are going to be 12 semester credits of biology. That will stay the same. And then we're going to do ask that you take 3 semester credits of biochemistry with the lab at a science major level, and 3 semester credits of organic chemistry, and then the 6 credits of humanities, psychology, and English. We have, unlike our winter class that will be starting here in a couple months, as of fall 2013, we have dropped the physics class requirement, so that's no longer going to be needed for fall and beyond. I do have one question regarding the prerequisites. Carrie, you asked, can a student complete prerequisite sciences courses in their first year of SCNM? Unfortunately, no. All of the prerequisites and all of these requirements have to be done prior to coming into SCNM. You don't necessarily have to have the prerequisites done and completed by the time you interview. So say, for instance, you're missing 4 credits of biology, but you're taking that in the winter or your spring, and then you're going to be ready for fall here at SCNM. Currently, we're accepting applications and interviewing for our winter 2013 class as well as our fall 2013 class. So you can go ahead and interview, and if you are accepted, you would be provisionally accepted, which just means that you have to finish that other biology course. But other than that, nothing is able to be taken at SCNM while you're in your first year. But that's a great question. I have another question from Jennifer regarding fall 2013 prerequisites. Will 4 quarter units of biochem suffice? Yes, absolutely. So it can't be less than 3, but it can be over 3. So yes, that's a great question as well. So that pretty much finishes our webinar. On behalf of SCNM, I would like to again thank Dr. Volk for her participation today and to each of you for joining us today. I do hope you found today's webinar informative. If I did not answer your question, I think I wiped them all out, but if I did not answer your question, please send me your question via my email at j.durham@scnm.edu. Again, thanks a lot for joining us and have a great day.